You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
All right. Hey, my name is Elise Cleveland. I'm a PGY3 with LSU's PM&R program. I'm happy to be here today with some of my co-residents. You can see them. They're also on video. So we're happy to be here to talk about the wonders of New Orleans and LSU's PM&R program. So please feel free to type in questions into the chat. We'll try to keep an eye on that, and then we'll get to all the rest of the questions at the end. All right, so this slide is just a reminder to all the medical students that if any of you on here right now are undecided on a specialty, this is why PM&R is so great. I think we were all drawn to this field because of its variety and the very real functional application to medicine that you can see in all these topics. We get exposure to all of these areas throughout our training. And there are options throughout the training to really concentrate in one area as well if you want. Anyway, it's a great field, and I think I speak for all my fellow residents that if you're planning on matching into PM&R, you have chosen well. So. All right, so here's some of that New Orleans wonder and charm that I mentioned before will be featured throughout this presentation. If you haven't visited us, the French Quarter is an obvious must see. All right, so fun stuff. So application requirements. I'm pretty sure this is fairly standard as far as what you need to apply to any program. Even though it was only 3 years ago that I did this, I definitely have blocked it from my memory. So our coordinator, Sarah Miller, is wonderful and very responsive. So if you have any application specific questions, I would reach out to her. We are a categorical program. We accept 6 PGY1 positions every year. I actually just talked to our coordinator today, and it sounds like interviews are going to be a mix of in-person and online hybrid. So it sounds like that kind of might be the plan going forward, but we'll kind of see as it approaches and as things change. So I did include our last year, our interns, step 1 score, the average, personal statement, and the COMLEX score is it's generally above 500. So. All right, so New Orleans is not just all city. We also have beautiful green spaces, parks, close to a lot of water, if boats are your thing, outdoor activities. So this is one of our beautiful parks right in the middle of the city. And co-residents that are on here, please feel free to jump in if you want to add anything that I'm forgetting. All right, so about our program. We'll get to the details. So as I mentioned before, we're categorical, which I think is really a big plus. Not having to move twice throughout residency is nice. We're very proud of our procedure numbers. I think that's one of the things that really drew me to the program was the amount of hands-on experience we get. I have a slide coming up that will show the numbers, but I can definitely say you'll feel confident leaving this program in your procedural skills, injections, ultrasound guidance, etc. So it is promoted for all residents to do research, scholarly activity, including case studies, writing book chapters, presentations, etc. So we are allowed 5 days of educational leave on top of our vacation every year for this as well. Our chief resident makes our schedule every year. So although we are very we're pretty heavy pain program, we get a lot of pain rotations. If you decide that that's not what you want to focus on, it's pretty easy for our chief resident to change up your schedule and give you rotations in areas that you want. So all except one of our rotations are in the New Orleans metro area. So if you live in the city, the commute is non-existent. I did med school in Chicago, and so coming here and like commuting like 10 minutes in the morning is amazing. So if you choose to live in the suburbs in New Orleans, it'll be a little bit longer, but really everything is really close. So that's really nice. Our didactics, we have an EMG nerve conduction study specific didactics on Wednesday mornings. And then on Friday afternoons are our main didactics. Here is a picture of our residents at our first didactics this year. All right, so here's those procedure requirements. So on the left are the ACGME minimum requirements, and then these are usually what our residents get, if not more, when they finish the program. So yeah, plenty of EMGs, probably more pain axial procedures than is even listed here, if you want that.
So jumping on the pain experience, as an intern last year, I logged over 50 fluoroscopic procedures, and that's just year 1 of 4. That was 2 pain rotations as an intern. By the time you finish our 4-year program, if you're interested in pain, you could do anywhere between 7 and 9 months. You think about a fellowship in pain, it's 1 year. So you get the amount of rotation experience of like 2/3 of a pain fellowship before you even start. That included facet, SI, transforaminal. Things that I was more of a spectator on were interlaminar, but at this phase, I was very okay with that. Overall, procedure numbers are really top notch, what really drew me here as well.
Yeah, thanks, Alpha. Yeah, it's definitely, let me see, sorry, I'm multitasking with the chat box. Yeah, definitely a lot of hands-on. I think even like a lot of our residents would feel comfortable with some of the basic axial injections when they finish residency, being able to do those in practice. So, and then going on to do the pain fellowship, you get, that experience with more invasive procedures like spinal cord stimulators and kyphoplasties and stuff like that. But we even do get some hands-on exposure to that as well. So. All right, lots of peripheral joint injections, lots of Botox, baclofen pump refills, ultrasound. Okay, here's a picture of myself and one of our PGY2s, Dr. Cooper, at our first didactics this year. So I can't not mention the amazing food in Louisiana and in New Orleans. Crawfish boils were new for me coming down here, and they kind of just like replace barbecues down here, and they're amazing. So. All right, program year 1. And we do have some of our interns are on here too, so if they want to chime in about how it's going. We get 3 weeks paid vacation. What's nice about being a categorical program is your first year, you actually get a lot of exposure to PM&R rotations, which is awesome. So you do 4 months with PEDS, PM&R, between the sports medicine clinic and then procedures with Botox and baclofen pumps, and then a mixture of outpatient and inpatient as well. We do 2 months interventional pain. There's some options for wound care exposure there as well. 2 months with rheumatology, 1 month family medicine inpatient, and then 2 months with internal medicine outpatient, which includes like cardiovascular clinic, podiatry, and a pain clinic as well. So, and then we do also 1 month of inpatient rehab our intern year. So
I can chime in about the intern year so far. It's been pretty great, honestly. I think the biggest thing for me is that I feel like one with a family already since day 1. They really kind of just bring you in, and you're doing didactics with everyone every Friday. I had some questions about my first rotation. I was scared to death going in, about to introduce myself as a doctor. It's crazy. And I just called one of the upper levels, and he like talked me through it. And honestly, that's just a great family environment. Really, really supportive.
And to piggyback off of Zach, he's right. All the upper levels have been really great. Just calling you whenever you might need something. Like I had 2 of them call me just randomly before my first day of intern year, and they helped walk me through what I should expect. And it was just a very welcoming and inviting type of environment. And all these people are really, really good people.
Having just finished my intern year, the thing that's really cool about this year, now being on predominantly PM&R rotations, is the background it provides. If you think about things like getting 2 months of rheumatology, it helps you be able to differentiate between inflammatory versus degenerative arthritis, something that someone with RA may also have, facet-mediated lumbar spine pathology, and it's important to be able to discern the two. The family medicine rotations, really good hospital experience for Toro inpatient rotations. If we're on the cardiology rotations, we're learning the difference between neurogenic versus cardiogenic claudication. And so a lot of the time you spend as an intern is learning very PM&R specific skills in non-PM&R rotations. And then we also get things like sports medicine that's under that sports medicine umbrella, but it's a physiatry trained, sports medicine fellowship trained sports medicine doctor. So we get that exposure as well as an intern. So now that I'm on a general PM&R clinic, I feel much better prepared for the breadth of exposure, whether it's TBI, spinal cord injury, or MSK, musculoskeletal complaints, neurologic.
Awesome. Thanks, guys. Yeah, so that's kind of the intern year. And pretty much all of our interns take step 3 during the intern year. You definitely have time to study for it. So here is a picture of our current intern class on their orientation day with their snazzy t-shirts. So with our chief resident. All right, so program years 2 through 4. So we have 4 weeks of paid vacation. We do a lot of inpatient adult rehab. I will mention, I didn't put it on here, but I know a lot of people ask about the call schedule. We do at-home call. So you're running your own team with an attending, and usually residents carry anywhere between like 10 to 15 patients. And some of them can be fairly high acuity. So it can be a very busy inpatient month. So you're on call overnight from home for all of your team, your patients, and then we hand off our teams on the weekends, and we split up the weekends through the month. So you're on call usually 1 weekend a month. So very rarely do our residents, I think, have to come in from home for something. There is like a call, a rapid response like medicine in the hospital. So if it's something really severe, they have somebody there. But for other minor issues or other stuff kind of going on, you handle the call. So
Dr. Cleveland.
Yeah.
I just wanted to add that I'm on call right now and I'm big chilling with y'all as an example.
Yes. Awesome. Yeah. So it depends. It's on how, what's going on with your patients, how busy you can be. Some months can be crazy. Some are manageable. So, but it's definitely good exposure to a lot of high acuity patients. So we do inpatient consults at 2 different hospitals. We do some wound care and burn rehab as well. We have EMG, nerve conduction study months. And then we have a general PM&R musculoskeletal clinic at 2 different hospitals here. And we're at that clinic, we have like a weekly spinal cord clinic, weekly amputee clinic. Our ALS clinic is monthly, and then injection clinic is every week. Lots of interventional pain, as we've talked about, sports medicine rotations, and then peds rehab as well. Anyone have anything they want to add about any of our rotations?
Really big right now is ultrasound guided injections, diagnostics. I'm at the VA currently, so we're seeing a wide breadth of patients with sometimes complex medical histories, and being able to sift through all that and then be able to pull up the ultrasound to aid in diagnosis and guide the procedures. In this first month, I've been able to do 20 ultrasound guided injections, and we're going to have a bunch more months to come. So getting all those important reps.
5 minutes left, guys.
Okay.
I've only just started this past month, but I've already hit maybe a majority of my Botox injections. So just being a month in and being able to get those out of the way is pretty cool.
Same here.
Awesome. Here's just some more pictures of some of our residents. We had like a raffle at our first didactics, and Dr. Reuter won an espresso maker. He's really proud about that. So last kind of slide, living in New Orleans, you will never be bored. There's always something going on here. I mean, if you haven't been to Mardi Gras, you definitely should come. Festivals every weekend. I kind of talked about the amazing food, Gulf Coast attractions, lots of outdoors activities, and then we have some great professional sports teams as well. So yeah, it is a good time. All right, so I think we can take some questions. Let's see, do we have anything in the chat?
It's a question about the program not being listed on ERAS yet. I don't know if any of us could properly answer as to why, but it's something we'll follow up with our program coordinator and figure out why that is.
Yeah,
I have another question about favorite part about New Orleans. So I did med school here. So, you know, this is going to be another 4 years plus another 4. Honestly, the people are amazing. They're so fun loving and approachable and friendly. Also, there's always stuff going on every like Friday and Saturday. I hear music from my apartment in Uptown. You just like walk over, hang out with your neighbors and listen to music. It's just an amazing city. It's really, really full of life. And it's awesome to live here. Love it.
You might have to build an extra 5 minutes into your travel time just in case if on your way to clinic, someone stops to chat you up. People are very friendly. There's a lot of striking up conversation with strangers. In terms of the music here, I'm coming from California, and the free bands that are playing all across the town are like $20, $30 cover charges in other cities. The raw musical talent is just incredible. It's a really one of a kind experience to be able to hear this much talent all over the place for free.
Looks like we have another question about, are there sports med coverage opportunities outside the rotation? Yeah, definitely. Did any of you guys go do any of the football games, like sideline coverage with Carlin? Alpha, I don't know if you did that all.
I was not on with him at the fall. I had some, because Robin's thinking about doing sports medicine, so he did a few of those coverages. So you have some opportunities to do some high school coverage. And there's always opportunities to potentially find some more. There aren't too many sports medicine bound folks in our program, but where there's always room for more.
And I think we have the opportunity, Dr. Curso, who works at Tulane here in New Orleans, does a lot with the sports teams and like race medicine and stuff. And so I know we're talking with him about trying to get more involved in some of that as well. So yeah, it's definitely, it's there. If you happen to be on the rotation during the football season, I think you're required to go to a few games with him. But if we've had residents in the past go to like every game of the season with them. So it just depends on if it's interesting to you.
One of the attendings we work with at Ochsner, so Dr. Carlin was his attending and he wanted to do sports medicine. So he went and covered with him and then ended up getting a job just down the hall from him. So the sports medicine interest is there, there's opportunities. And now he's one of the most talented people I've seen with an ultrasound.
A little under 2 minutes left, guys.
I briefly answered a question in the chat about where most people live. So I know a lot of people live in Uptown, which is, like 5-10 minutes away from downtown. A lot of Lakeview people. So that's kind of near where City Park is. City Park's massive. So if you want some green space or just want to go bike on the lake, that's awesome. I lived there for a few years too before moving downtown.
Oh, how DO friendly. Yeah, we have I know we get a few DO residents through our program. I think we have at least a couple right now. Yeah.
I'm a DO, so they're very friendly around here.
Our chief. Yeah, exactly. Yeah, go ahead, Alpha.
Our last chief, so the graduating chief, who's now a fellow in our pain program, was DO trained. A lot of appreciation, respect for the multiple perspectives it comes to PM&R treatment. I had, when I was a med student, a DO trained attending, and I found their insight invaluable. So I think we value perspectives of all backgrounds and whatever we can do to help make patients' lives better.